Hi, so today is March 14th, 2022, and today would be considered my second Tanzania day. So the first Tanzania day, I described the community of Rundagai, so today I'm going to go over our clinic day at Rundagai. This would have been our second day at the site, and I worked with Dr. Rob, Kelly Hall, all of our peers again, our host Teddy, our translators, and then in addition we also had Dr. Allen and Dr. Octavian. What did we do that day? So on the clinic days, we basically had the community members come in with their little slip with the time and date, and we would just kind of start seeing them one by one. Our roles, we had like three little stations, I guess, like three little rooms that we broke up into groups of three, and then we also had a pharmacy, and Shannon did the pharmacy in the morning, and then I did the pharmacy in the afternoon that day. And so we broke up into groups. We did intakes, so we would get their height and their weight, we would get their name, their date of birth, and then we would also kind of go over their chief complaint, grab their vitals, go over a little bit of their history, that kind of stuff, any allergies, and then we would also do focused assessments. So if they're coming in for like knee pain or something, we immediately kind of think like, all right, maybe a little bit of arthritis. So I would check both knees, and let's say their right knee was giving them pain, I would look at their left knee, which would be their baseline, and then compare the normal to the abnormal. And we would look for like any edema, any erythema, stuff like that. And then I would also feel for crepitus. So that's just like an example of the types of assessments we would do. Heart, lungs, abdomen, listening, palpating, stuff like that. And then once we were finished with that, the doctor would come in, and Dr. Allen and Octavian would switch on and off. They would, in Swahili, talk to the patient, and our translators would translate for us. We would provide some simple education for what we knew type of thing. The doctor would then also ask us if we had any questions or any comments, and then he would write a script for the patient, and they would be sent to the pharmacy where they would get their medications. So that's what we did for that portion. In the pharmacy, we had lots of different meds. We had heart meds, we had a lot of cold and flu medicine. What else did we have? We had a lot of NSAIDs. We had parasitic medications as well. We used quite a bit of that. Trying to think. We had lots. But the doctors would write out the script, and that was kind of hard to pick up on at first, because the way they write scripts is not how it's written here in America. For example, a doctor would write like azithromycin 1 × 2 × 10, and I was like, what? So after our host explained it to us, it basically means azithromycin 1 pill 2 times a day for 10 days. So once I understood that, I was able to get the hang of it, and then fill in like little baggies their medications, write the directions on it, and then I would present it to the patient and kind of go over any adverse effects that's needed, just some simple like medication explanations, and our host Teddy would translate that for us. So this was definitely more of a participation day. I did vitals, I did the intakes, and I did the height and weights, and then I also filled scripts in the pharmacy. And then for course objectives, I would say I met course objective number 2, utilizing the nursing process and providing care to families and communities, accurately describing action, side effects, dosage, toxicities of selected medications. So I just explained that. And then course objective number 5, use principles of health education in teaching and counseling of families and communities on aspects of health promotion and healthcare. So we would basically teach them a little bit about, for example, like if they're having open fires in their house, to cook dinners, to maybe move that to outside or a different portion, because we were having kids coming in with a lot of asthma or respiratory issues, and so we were doing education on that and many other things. So I met a lot of the course objectives, but those are just 2. And then recommendations, I really don't think that I would do anything differently on that day. I really threw myself in there and tried to do everything. So yeah, overall it was a good day. Thank you.